What if I told you that right now you could be on the path to type 2 diabetes and not feel a single obvious symptom? No severe pain, no emergency, no dramatic warning, just a quiet shift happening inside your body. And by the time most people realize it, years have already passed. Today we're talking about prediabetes, the early warning stage your body gives you before type 2 diabetes fully develops. And the truth is, millions of Americans are living with it right now without knowing. If you care about your long-term health, your energy, your heart, your future, stay with me. Welcome to Mind and Body Education. If you value simple, clear medical information that could literally change your life, take a second right now to subscribe and turn on notifications. We post practical, science-based health content designed to help you take control early, not after damage is done. Now here's the part most people don't realize. Prediabetes is not almost diabetes. It's not harmless, and it's not something you can ignore. It's a metabolic warning sign. Prediabetes happens when your blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. Think of it as the middle zone between healthy glucose control and full disease. And this middle zone matters because without action, many people with prediabetes go on to develop type 2 diabetes within a few years. But here's the powerful part. This stage is often reversible. Let's talk about the early warning signs and why most people miss them. Prediabetes is often called a silent condition. Many people feel completely normal. No dramatic symptoms, no red flags that scream danger. But sometimes your body whispers. You might notice increased thirst. You feel like you're drinking more water than usual. You might urinate more frequently, especially at night. Why? Because when blood sugar rises, your kidneys work harder to filter out excess glucose, and that pulls more fluid out of your body. You may feel fatigue that doesn't make sense, not just "I stayed up late tired," but a persistent low energy feeling. That's because your cells aren't using glucose efficiently. Sugar's in your bloodstream, but not getting into your cells properly. Some people notice blurred vision. High blood sugar can temporarily affect the lens of your eye, changing how it focuses. Another important sign, darkened patches of skin, especially around the neck, underarms, or groin. This condition is called acanthosis nigricans. It can look like velvety, darker skin and is often a visible sign of insulin resistance. Slow healing cuts, frequent infections, these can also be subtle clues. But here's the key message. You can have prediabetes and feel completely fine. That's why testing is critical. So how is prediabetes diagnosed? There are three main tests doctors use. First, the fasting plasma glucose test. This measures your blood sugar after you haven't eaten for at least 8 hours. A normal fasting glucose is under 100 milligrams per deciliter. Prediabetes is diagnosed when that number falls between 100 and 125 milligrams per deciliter. Second, the oral glucose tolerance test. You drink a glucose solution and your blood sugar is measured 2 hours later. If that 2-hour number falls between 140 and 199 milligrams per deciliter, that's prediabetes. Third, the A1C test. This one is powerful because it reflects your average blood sugar over the past 2 to 3 months. An A1C between 5.7% and 6.4% indicates prediabetes. Here's something interesting. Sometimes one test is abnormal, while another looks normal. That's because each test measures a slightly different aspect of how your body handles glucose. That's why your doctor may repeat testing or use more than one method. Now let's talk about who is at most risk. If you're over 45, your risk increases. If you're overweight or obese, especially carrying weight around your abdomen, risk increases significantly. If you're physically inactive, meaning less than 150 minutes of moderate exercise per week, your risk rises. If you have a family history of type 2 diabetes, that matters. Certain ethnic groups in the United States, including African American, Hispanic or Latino, Native American, and Asian American communities have higher rates. Women who had gestational diabetes during pregnancy are at higher risk later in life. Poor sleep, chronic stress, Diets high in refined carbohydrates and sugary beverages, these all contribute. But risk is not destiny, and this is where the conversation shifts from fear to control. Because prediabetes is a window where intervention works extremely well. One of the most important studies ever conducted on this topic was the Diabetes Prevention Program. Researchers found that lifestyle changes reduced the progression to type 2 diabetes by 58% over about 3 years. 58%! That's not a small improvement, that's a major shift in trajectory. And what did they do? They didn't use extreme measures. They focused on 3 pillars. First, modest weight loss. Losing just 5 to 7% of body weight made a powerful difference. For someone who weighs 200 pounds, that's about 10 to 14 pounds. Not 50, not 80, 10 to 14. Second, physical activity. At least 150 minutes of moderate intensity activity per week. That could be brisk walking 30 minutes a day, 5 days a week. Add resistance training 2 to 3 times weekly to improve insulin sensitivity even more. Third, dietary changes. Reducing processed carbohydrates, cutting back on sugary drinks, increasing fiber intake, choosing whole grains over refined grains, emphasizing vegetables, lean proteins, healthy fats. Small, consistent improvements, not perfection. Now, some high-risk individuals may also be prescribed metformin. This medication reduces glucose production in the liver and improves insulin sensitivity. In studies, it lowered diabetes risk, though lifestyle changes were often even more effective. Newer medications like GLP-1 receptor agonists are also being studied in this area, especially for people who struggle with weight management. But again, lifestyle remains the foundation. Here's something many people overlook. Prediabetes itself is not harmless. Even before full diabetes develops, elevated blood sugar can increase the risk of cardiovascular disease, heart attacks, stroke, nerve damage. Subtle vascular changes can begin earlier than people expect. This is why early action matters. You are not just preventing diabetes, you are protecting your heart, your brain, your kidneys, your long-term quality of life. So what should you do starting today? If you haven't been tested and you're over 45, ask your doctor. If you have risk factors, ask for screening. If you've already been told you have prediabetes, don't panic. Instead, build a plan. Start with movement. Even a 10-minute walk after meals can improve blood sugar control. Audit your drinks. Liquid sugar is one of the fastest ways to spike glucose. Increase protein and fiber at meals to slow glucose absorption. Prioritize sleep, 7 to 9 hours if possible. Track your numbers. Monitoring creates awareness, and awareness drives change. And here's something important for motivation. Prediabetes does not mean you failed. It means your body is asking for adjustments. Many people who take action at this stage never develop type 2 diabetes. That's powerful. Before we close, I want you to think about something. If nothing changes, where will your health be 5 years from now? And if you make small, consistent changes starting this week, where could you be instead? Your future health is shaped by patterns, not one perfect day. If this video helped you understand prediabetes more clearly, comment below with one action you're committing to this week. Is it walking daily, cutting sugary drinks, scheduling a blood test? I read the comments, and your commitments might inspire someone else. Share this video with a friend or family member who needs this information. Sometimes the most life-changing conversations start with a simple share. And if you want more practical, science-based guidance on protecting your mind and body, make sure you're subscribed to Mind and Body Education. Your body gives warnings quietly. The question is, will you listen early or later? Take action now. Your future self will thank you.